Have you noticed that your body responds differently now than it did 20 years ago? Maybe you've wondered if what once felt natural now seems complicated. Or perhaps you're questioning whether the way you've always approached self care is still what your body actually needs. If these thoughts sound familiar, you're definitely not alone. This is one of the most frequent concerns I hear from men over 60 in my practice. Not just whether it's still appropriate to masturbate, but how to do it in a way that truly supports your health rather than working against it. I'm Dr. Jocelyn, and over the past 15 years, I've helped thousands of men navigate the changes that come with aging, including the ones nobody talks about. Men who want to maintain their vitality, feel confident in their bodies, and approach this stage of life with both wisdom and strength. Today, we're discussing something that affects nearly every man over 60, yet rarely gets the honest medical attention it deserves. How to masturbate safely after 60, and the 5 critical mistakes that could be undermining your health without you even realizing it. This isn't about performance anxiety. This isn't about comparing yourself to your younger self. This is about understanding what your body needs now, protecting your long-term health, and maintaining a positive relationship with your own sexuality as you age. If you've ever felt uncertain, frustrated, or even a little embarrassed about these changes, you're in exactly the right place. Let's start with some reassuring truth. First, I need you to hear something clearly. Masturbation after 60 isn't just normal, it's beneficial. And I'm not saying that to make you feel better. I'm saying it because the medical research consistently shows this. Regular, gentle self-stimulation supports prostate health by promoting healthy blood flow and helping to clear potentially stagnant fluids. It maintains penile circulation, which becomes increasingly important as blood vessels naturally become less flexible with age. It reduces stress hormones like cortisol, which can interfere with healthy sleep patterns and immune function. But here's what many men don't understand. Your body at 60 is not your body at 30. And that's not a failure. That's evolution. Your skin has different sensitivity. Your circulation patterns have shifted. Your nervous system processes stimulation differently. Your hormone levels have naturally adjusted. This doesn't mean less pleasure. It means different pleasure. Often it means deeper satisfaction when you work with your body's new rhythms instead of against them. Unfortunately, most men make the same 5 mistakes because they're trying to force their 60-year-old body to respond like it did decades ago. And that approach doesn't just fail, it can actually cause harm. Let me show you what I mean. Mistake number 1, the frequency trap. This is probably the most common mistake I see, and it goes in both directions. Some men think they should masturbate as frequently as they did in their 20s or 30s. Others believe they should stop altogether, thinking it's somehow inappropriate at their age. Both approaches miss the point entirely. Your body's natural rhythm has changed. Your testosterone levels, your recovery time, your sensitivity cycles, they're all different now. And when you ignore these changes, you create problems. If you're forcing frequency your body doesn't want, you can end up with soreness, reduced sensitivity, and even a negative association with touch. You might notice it takes longer to become aroused or that satisfaction feels elusive. On the flip side, if you avoid masturbation completely, you're missing out on significant health benefits. Use it or lose it isn't just a saying, it's physiology. Without regular blood flow, tissues can become less responsive. Without regular stimulation, sensitivity can genuinely decrease. The solution? Listen to your body, not to a schedule. Some weeks you might feel inclined 3 times. Other weeks, once might be perfect. There's no magic number. There's only what feels right for your body right now. Your frequency should feel natural, satisfying, and leave you feeling relaxed rather than drained. Mistake number 2, ignoring lubrication. I cannot overstate how important this becomes after 60. Yet it's the mistake I see most often, and it causes more problems than men realize. As you age, your skin produces less natural moisture. The delicate tissue of the penis becomes thinner and more susceptible to irritation. What once felt comfortable without lubrication can now cause micro tears, inflammation, and genuine discomfort. but many men resist using lubrication. Maybe it feels unnecessary or clinical or somehow admitting defeat. I understand that mindset, but I need you to reconsider. Think of lubrication as protection, not assistance. You wouldn't go for a long walk without appropriate shoes. You wouldn't spend hours in the sun without sunscreen. This is the same principle. You're protecting tissue that deserves care. Choose a high-quality water-based lubricant without fragrances or numbing agents. Silicone-based options last longer, but can be harder to clean. Avoid anything with warming or cooling effects. Your skin doesn't need additional stimulation. It needs protection. And please never use soap, lotion, or other household products. These can cause irritation, disrupt your skin's natural pH, and even lead to infections. When you use proper lubrication, you'll likely notice that sensation actually improves, not decreases. You're removing friction that was interfering with pleasure, not adding something artificial. Mistake number 3, the death grip syndrome. This is where many men get trapped without realizing it. As natural sensitivity decreases with age, the instinctive response is to compensate with pressure. Grip harder, move more aggressively, try to force the same response you use to get easily. But your penis isn't designed for that kind of force, especially as you age. The tissue becomes more fragile, the blood vessels are less resilient, the nerves are more sensitive to pressure-related damage. When you consistently use too much pressure, several things happen. You can actually reduce sensitivity over time by essentially overriding your nervous system. You train your body to respond only to that specific intense stimulation. This makes it much harder to enjoy gentler touch, whether from yourself or a partner. You also risk tissue damage, bruising that you might not see but definitely affects function, irritation that leads to inflammation, and inflammation that interferes with healthy blood flow. Here's the counterintuitive truth. Lighter touch often produces stronger, more satisfying sensations once your body adjusts. But you have to give it time to recalibrate. Start by consciously loosening your grip by about half of what feels normal. Use more lubrication to compensate for the reduced friction. Focus on different types of movement. Circular, gentle pressure changes, varied speeds. It might take several sessions before you notice improvement, but when you do, you'll understand why this approach is so much better for long-term health and satisfaction. Mistake number 4, rushing the process. In our culture of instant everything, many men approach masturbation like it's another task to complete quickly. Get in, achieve the goal, move on with the day. But your body after 60 operates on a different timeline. Arousal builds more gradually, blood flow increases more slowly. Your nervous system needs more time to fully engage. When you rush, several counterproductive things happen. Your stress response system activates, which actually restricts blood flow to the genitals. Your breathing becomes shallow, reducing oxygen to tissues that need it for optimal function. Your mind stays partially distracted, preventing the mental relaxation that's crucial for deep satisfaction. You end up working against your body's natural processes instead of supporting them. The solution isn't necessarily to spend hours on this. It's to approach it with patience and presence. Even adding 5 or 10 minutes to your usual routine can make a dramatic difference. Start with a few deep breaths. Allow yourself to become mentally present. Notice how your body feels without immediately trying to change anything. Think of this time as a form of stress relief, like meditation or a warm bath. The goal isn't just physical release, it's nervous system regulation, circulation improvement, and emotional well-being. When you approach it this way, you'll often find that satisfaction comes more easily and feels more complete. Mistake number 5, neglecting the emotional component. This is the mistake that most men never see coming, and it might be the most important one we discuss today. Many men carry decades of conflicted feelings about masturbation. Maybe you grew up with religious or cultural messages that it was shameful. Maybe you've always felt like it was something you should outgrow. Or maybe the changes in your body have left you feeling disconnected or frustrated. These emotional undercurrents don't just affect your mood, they directly impact your physical response. Shame, anxiety, and frustration trigger stress hormones that interfere with arousal, reduce blood flow, and prevent the deep relaxation necessary for genuine satisfaction? I see this constantly. Men who are physically healthy but emotionally conflicted, and their bodies simply won't respond the way they expect. The solution starts with self-compassion. You're not broken. You're not behind some imaginary schedule. You're not less of a man because your body has changed. You're in a new phase of life that requires different wisdom, different approaches, and different kindness toward yourself. If you're carrying guilt or shame, consider talking to someone about it. A therapist who specializes in men's health, a counselor who understands sexuality and aging, or even a trusted friend who can offer perspective. You don't have to figure this out alone, and there's no shame in seeking support. When you can approach self-pleasure from a place of self-care rather than self-criticism, everything changes. Your body relaxes, your mind settles, and satisfaction becomes not just possible, but profound. So, what does a healthy self-pleasure routine actually look like after 60? Let me give you some practical guidelines. First, create the right environment. Privacy, obviously, but also comfort. A space where you can truly relax. Turn off distractions, your phone, the television, anything that keeps part of your attention elsewhere. Start with basic hygiene, clean hands, fresh towels if you use them. This isn't just about cleanliness, it's about treating your body with respect. Use quality lubrication from the beginning, not just when you think you need it. Protection is always better than treatment. Allow yourself time, not hours, but enough time that you don't feel rushed. 15 to 30 minutes is often perfect for allowing your body to fully engage and respond. Listen to your body throughout the process. If something feels uncomfortable, adjust. If you need more lubrication, add it. If you need to slow down, slow down. And here's something important: don't make orgasm the only goal. Sometimes the journey is more valuable than the destination. The improved circulation, the stress relief, the mind-body connection, these benefits happen regardless of whether you climax. Pay attention to how you feel afterward. You should feel relaxed, satisfied, and positive about the experience. If you feel frustrated, sore, or emotionally negative, consider adjusting your approach. There are times when you should absolutely consult with a healthcare provider about these issues. If you experience pain during or after masturbation, that's not normal aging. That's something that needs attention. If you notice significant changes in sensation, erectile function, or satisfaction that concern you, don't just accept them as inevitable. Many age-related changes can be addressed with proper medical care. If you're dealing with emotional or psychological barriers that feel too big to handle alone, reaching out for professional support is a sign of wisdom, not weakness. And if you have specific health conditions, diabetes, heart disease, prostate issues, or medications that affect circulation or sensation, have an honest conversation with your doctor about how to approach self-pleasure safely. Remember, your healthcare provider has heard these questions before. You're not unusual, embarrassing, or inappropriate for asking about these aspects of your health. Here's what I want you to understand above everything else. Your sexuality, your pleasure, your relationship with your own body, these don't have expiration dates. They evolve, they change, they require different approaches at different stages of life. But they remain a vital part of who you are as a complete human being. Approaching self-pleasure with knowledge, respect, and patience isn't just about physical release. It's about maintaining your connection to your body, supporting your overall health, and honoring the person you've become. You've earned the right to feel good in your own skin. You've earned the right to pleasure without shame. You've earned the right to approach this aspect of your health with the same care and attention you'd give to exercise, nutrition, or sleep. So the next time you give yourself this gift of attention and care, remember what we've discussed today. Slow down, be gentle, use protection, stay present, and approach yourself with the compassion you'd show a good friend. Your body has served you well for 6 decades or more. It deserves nothing less than your kindness and respect. If this information has been helpful, I'd be grateful if you'd subscribe to the channel. We're committed to having honest, necessary conversations about men's health at every stage of life. And remember, you're not too old, you're not past your prime, and you're definitely not alone in navigating these changes. Stay informed, stay healthy, and most importantly, be kind to yourself.